This person asked a question that for the CS mothers, should we wait for labor pain? Well, I don't know what you mean by for CS mothers. Whether you have been scheduled for a cesarean section without having CS in the past, or you already had a cesarean section in the past. But whatever the case may be, let us take it one after the other. If you have not done any surgery before, that is any CS to deliver a baby before, and you have been scheduled to do a cesarean section for one reason or the other. Generally speaking, there are some women that have been told that they are going to do a cesarean section and they later deliver their baby themselves. Again, there are some indication that we call absolute indication that even if you have not done a cesarean section before, there is no way you are going to deliver your baby yourself. One of them is if your baby is in transverse line. Another one is if you have a huge mass like a fibroid or an ovarian cyst that is occupying the opening of the womb. There is no way you can deliver such baby yourself. So why do you want to go into labor when you know absolutely this baby cannot come out? You are going to be having two sets of pain. The labor pain, then when you go for the cesarean section, that is another pain. So in that case, there is no need of waiting for you to go into labor before you go for your scheduled cesarean section. Usually when you are booked for a cesarean section, it is an elective CS. You will be told a particular day you are going to come to the hospital for your cesarean section because it's usually scheduled at 37 weeks. So we don't want you to go into labor. That is why you schedule it for 37 weeks. But if you have had cesarean sections in the past, especially if you have had two before, it is an indication for a cesarean section because we don't want you to go into labor. Because if you go into labor, there might be a rupture of that part of the previous scar you had even before you deliver a baby, and that will be a serious matter. It could result into severe bleeding, and you might even lose the baby and the mother in that process. So for a two previous scar, someone that has had two cesarean sections before, please don't even think of going into labor because these CS are usually elective CS. So if you have waited for you to go into labor before coming to the hospital because you are trying to deliver a baby yourself, when you come to the hospital, cesarean section that is supposed to be elective is now becomes emergency. Everybody will start running around in order to quickly bring out the baby and prevent your womb from rupturing. So I think I've been able to answer your question. If you have had two cesarean section before and even one, depending on the country you have found yourself, please don't even try to go into labor before you go to the hospital. You'll be told already that at 37 weeks, come to the hospital, you are going to have a cesarean section. If you wait until you are going into labor, that elective CS becomes emergency. But if you have not had CS before and the indication for your cesarean section is probably a relative one, is not absolute, well, there are instances that you can still deliver a baby yourself even if you go into labor. But always follow your doctor's advice. If you have been scheduled for a cesarean section, please go for it. That is an elective CS. If you are going there at the wrong time, it becomes an emergency. It could be life-threatening and you're even going to spend more money in that process. If you like my video, please follow for more. Till we meet again, I remain Dr. Mo.